Today I'm going to talk about important information about dogs. Most people get dogs because they're fun and loving. They're a member of your family. But there are many things that people need to know about raising a dog. I'm going to talk about two that are important to me: heartworm disease and the parvovirus. Through working in a vet clinic for the past 11 years, I've seen them both more than I care to. Most of the time, animals get the heartworm disease or parvovirus simply because the owner has not been properly educated. Today, I'm going to educate you briefly about heartworm disease and the parvovirus. What is heartworm disease, you ask? The American Heartworm Society has a great website that has a lot of useful information on it. I've used this website along with my experience at working for a vet clinic to talk about heartworm disease. Heartworms is a parasite worm that gets into the bloodstream and migrates to the lungs and eventually to the heart if left untreated. Dogs get heartworms through a mosquito bite. A mosquito bites an affected dog and then bites another dog. Heartworms is most commonly found in dogs, but can also be found in cats, wolves, and coyotes. Mycophilaria is what the mosquito transmits into the dog. It takes a few months before the dog gets full-blown heartworm. A blood test can be done to test the dog's antigen to decide whether or not the dog has heartworm disease or not. At the beginning stages of heartworms, there are no signs usually. Later in the stage, dogs who've had heartworms for many years can sometimes show persistent cough, lack of appetite, lack of energy, and eventually weight loss. There is treatment for heartworm disease. One option is imiticide. It is a drug that has been FDA approved. It can have complications, usually not. In the most severe cases, heartworms are surgically removed, which is very dangerous and costly. Both treatments are very expensive. There is a way to prevent heartworm disease, and that's by giving a once a month product. There are several to choose one. Some of those are Sentinel, Iverheart, and Trifexis. Now I'm going to show you 3 pictures about heartworm disease in the United States. This first one is a picture of heartworms in a dog's heart. The second one is a dog that has heartworms in their pulmonary artery of a dog. This third one is the map of the United States showing where most cases of heartworms are found. As you can see, most cases are found in the southern states. Now I'm going to discuss the parvovirus. It is a viral infection that attacks the intestinal tract. This virus is very contagious. It can be transmitted from people to dog, dog to dog, or objects that an affected dog has touched with their feces. The virus can show the following signs: vomiting, diarrhea with usually blood in it, lethargy or depression, and loss of appetite. There is no treatment for the parvovirus. Typically, a veterinarian recommends supportive care that requires a pet to be on IV fluids for several days, also giving an injection for nausea and antibiotics. If left untreated, the pet can become septic. Also, it weakens the muscles around the heart and eventually can cause death. The best way to prevent your pet from getting parvovirus is by vaccinating them. Talk to your local veterinarian about their recommendations. Any dog can get the parvovirus, but it is typically found in puppies and young adults. It is expensive to treat parvo. Remember, pets are part of our family, but just like you and I, they require going to the veterinarian at least once a year. Part of a dog's annual visit is heartworm testing and the parvo vaccine. The parvo vaccine also includes hepatitis, distemper, and parainfluenza. If you have any questions or concern, it's always best to contact your veterinarian and ask them. Remember, it's always cheaper to prevent heartworm disease and parvovirus than it is to treat them. Thank you.